Right, we're already up to 45 participants, so that's awesome. I'm really excited Milind could come join us today. I know from personal experience, he's not only an amazing researcher, but he's also an amazing person, a great advisor. So I'm really glad he's here talking about his research. As you can see from this slide, he's the director for the Center of Research on Computation and Society, and he's also doing AI for social good, directing the AI for social good in Google Research India. I know him from his amazing work with the Team Core group, which he still leads. And for years, Milind would tell the multi-agent community, you know, you're working on DCOPS. Why do we care? Yes, it's great math, but where are we going to really change the world? And that's what he's doing. He's getting out there, and the solutions and the techniques he's going to tell you about are fielded and are making a difference today. And that's why I'm super excited that he is here to talk to us about this. So thank you, Milind.
Well, thank you, Matt, for such a fantastic introduction. And I am so delighted to be among friends, and so delighted that you are here, Matt, so we can get to talk. Thank you. So for the past 15 years, me and my research group have been focused on AI and multi-agent systems research for social impact in areas of public health, conservation, and public safety and security, focusing on the challenge of how to optimize our limited intervention resources. Among the topics I'll cover is public health. Here we have large populations to serve, but limited number of public health resources. Concrete example of one project I'll cover is work we've done with youth experiencing homelessness in Los Angeles. Harnessing the social networks of these youth, we are able to show that our influence maximization algorithms are far more effective in spreading HIV information and reducing HIV risk behaviors compared to traditional approaches. The technical areas I'll focus on here are social networks and bandit algorithms. With respect to conservation, we have large conservation areas to protect, limited number of ranger resources. Concrete example is work we've done in Cambodia and Uganda. Harnessing past poaching data, we are able to predict where poachers set traps. And for the past several years, have been able to remove thousands of these traps, thus potentially protecting endangered wildlife. The technical areas I'll focus on here are combining machine learning and game theory, or so-called green security games. So public health and conservation are two topics I will cover. In the past, we have also worked on public safety and security, contributing a new model called Stackelberg security games, and contributing new algorithms based on this model that have been used by security agencies in the United States, such as the Federal Air Marshals, the Coast Guard, and others. These are the first applications of computational game theory for operational security. But today, given the limited time, I'll limit myself towards the work we've done in public health and conservation. As you go through all of these projects, you'll see three common themes. All of the work we are doing is in service of the inspiring work done by nonprofits around the world. On the right side here are nonprofits that we're working with Google Research India. And on the left are some of the other nonprofits that we have been working with. In all of this work, ultimately, the goal is to empower these nonprofits to use AI tools and avoid being gatekeepers to this AI technology for social impact. The second common theme is a use of this data to deployment pipeline, in the sense that we start our work with immersion in the domain, talking to the nonprofits, understanding their challenges and the kind of data that are available. A predictive model then makes predictions of which of these data, which of the cases they face are high risk versus low risk. And then prescriptive algorithm then comes in, because even though we may be able to predict which of the cases are high risk given limited resources, we can only intervene on a limited number of cases. And that's where our multi-agent reasoning and innovations come in, as you'll see in the talk, in terms of influence maximization in social networks, or in restless bandits, or in game theory. And finally, field testing and deployment is crucial in our work, because ultimately social impact is a key objective of this work. So with this introduction, I'll I'll present the outline of this talk, first focusing on public health and then conservation. I'll cover papers from 2017 to now, and I'll highlight the role of the key PhD students and postdocs by putting up their pictures in the top right-hand corners on the papers that they led. So let's start with social networks. Motivating domain here is preventing HIV amongst youth experiencing homelessness. There are 6,000 youth who sleep on the streets of Los Angeles every night. The rates of HIV amongst these youth are 10 times the rates of the normal house population. So homeless shelters use this peer leader-led campaign to spread HIV information. They'll call a set of peer leaders, educate them about HIV, and expect them to talk to their friends and their friends to talk to their friends. And in this way, information to spread in the social network. Now, these are face-to-face interactions. This is not happening over Facebook, for example. This is the classic problem of influence maximization in computer science. You're given some social network graph. You have to choose k peer leader nodes in order to maximize expected number of influence nodes, maximize expected number of youth who get educated about HIV prevention. Now, information is assumed to spread in this independent cascade model. So youth A, with some probability, will talk to youth B will talk to their friend, youth C with some probability, and information will cascade in this network. So that's the assumption. As we try to apply standard influence maximization algorithms in our domain, there are three key challenges. First, the probability with which information spreads from youth A to youth B is uncertain. We are faced with a situation where peer leaders may be no-shows. So we invite a set of youth, some of them may not show up. So when we invite the next batch, we have to take into account who showed up, leading to a multi-step dynamic policy. And finally, the social network itself is not known. We could query a few of the youth in order to sample the network. And based on that, then figure out who are the key influencers to spread information. So I'm going to show you how we address these challenges, starting from the top, working my way towards this case of unknown social networks. So let's start with the first. Traditionally, in influence maximization, we assume that if we talk to youth C about HIV prevention, there's a known probability 0.4 that youth D will be informed about HIV prevention. But in our domain, immersion clearly showed that these probabilities are hard to estimate. So we can assume that we can sample this probability from some distribution. And in fact, in order to further model the uncertainty we face, can say that the mean of this distribution may itself lie within some interval. So now we're faced with this problem of robust influence maximization. On the one side, so we model this problem as a zero-sum game against nature. So on the one side is our algorithm that is trying to choose peer leaders. And on the other side is nature trying to choose parameter settings to cause our algorithm to perform as worse as possible. So we are trying to maximize payoff by picking these peer leaders. And nature is trying to minimize where the payoff of the game is this ratio of the outcome that we would obtain using our particular policy of choosing peer leaders to the optimal that would be possible if we knew nature's parameter settings ahead of time. So this is some kind of a regret being measured. Now, as this is a game, we come up with a mixed strategy, and then we sample a pure strategy from it, and so forth. Those details are in our Rama's paper. In this talk, I'm just going to give you an intuition of how we solve this large-scale game. So if we imagine a social network of 400 youth, and we are trying to select 40 peer leaders, that's 400 choose 40. That's a massive number of strategies for the influencers to choose from. And nature is trying to choose parameter settings from a continuous interval. So obviously, this is a massive scale game. So we try to solve these kinds of games by initializing the game with a small number of strategies on either side, say 2 on either side. And then you use this double oracle approach to converge. So we solve the game, and then an influencer's oracle will add the next best policy as its best response. And nature's oracle will add its best response as this next set of parameters to add. And the game grows, and we iterate in this fashion until convergence. And often we converge with a very small number of iterations and still do so with approximation guarantees that we can give. So this is a way in which we solve for robust influence maximization. Second, I mentioned we may want to invite 12 youth. However, we cannot accommodate all 12 in our homeless shelter for this particular education session. So we may invite only 4 at a time. We invite the first 4, but one of the youth decides to run away. Another one does not have the bus fare to come to our center and may choose to send their friend. So in the next time step, we have to take into account that the 4 we invited in the first time step didn't show up. 3 showed up and may not be the same as exactly who we had invited. So when we invite the next set of youth shown in green, we have to take into account who showed up in the first time step. So there's action uncertainty here. And there's also observation uncertainty because we do not know the state of the network. So this is a problem ideally suited as a POMDP. And we can solve this by recommending particular youth to invite. And then we get observations as to who actually showed up and then choose the next set of youth. Solving these POMDPs is extremely difficult, as we all know. Fortunately, what we find in this community are there sub-communities, youth who play basketball together, youth who hang out on the Venice beach together. And therefore, we can partition the POMDP and then solve these sub-community problems separately to generate our set of peer leaders. The third problem I mentioned is data collection is costly. We could imagine having our social work colleagues sitting in a homeless shelter, talking to all of the youth and constructing a very detailed social network by observing their interactions over some period of time. But this is a very costly effort in terms of time. If we could give them away so that they could only talk to, say, 15% of the youth, ask them who are their friends, and just from this sample of this network, then choose K peer leaders such that the performance of influence maximization that we get out of obtaining peer leaders from this small sample of network is similar to the best influence spread we would get with full network, that would be ideal. And so we've constructed this sampling algorithm, which samples nodes randomly, estimates the sizes of the community the nodes belong to, and then chooses seeds from the largest K communities. And we can provide some guarantees for this particular algorithm. Okay, so I've given you a sense of the 3 different challenges, and now it was time to take the solutions from these challenges that we've addressed and put them together in a single system and deploy it. So I'll call this system sampling healer to emphasize the fact that the network is not known, we've sampled it. So it has network sampling, robust policy generation, and multi-step policy generation. It tells us which peer leaders to invite at each step. We did a pilot test first. So sampling healer, you invited 60 youth when the network is not known. The second arm, healer, it is exactly the same as our sampling healer, but knows the full networks, roughly 60 youth here. Degree centrality, the traditional approach, bring in the most popular youth. This is the approach that is traditionally used, also knows the full network. And here we've, again, we tried to recruit 60 youth, 55 showed up here. In each case, we selected 12 peer leaders according to that algorithm. Our social work colleagues, and this is a picture of the information session going on. There's a whole day-long education session for the particular peer leaders that gets conducted to spread information. And now we wanted to know at the end of 1 month, how many of the non-peer leaders, those who we did not invite, got educated about HIV. And here's what we found. With degree centrality, only 25% of the non-peer leaders got informed. With Healer, our influence maximization algorithm with a full network, 75% of the non-peer leaders got informed about HIV. With Sampling Healer, which sampled a small fraction of the network, we performed similarly to Healer. Now, in fact, the performance seems to be slightly better, but that's because we may not, our total sample size here in terms of number of youth is small. But what this shows is that the Sampling Healer shows promise in terms of spreading HIV information. So now it was time to do a larger scale test. So we did so with recruiting 750 youth. This is joint work with Professor Eric Rice in social work. And here we are looking at actual change in behavior, not just whether youth were informed or not, but whether they actually changed behavior. And as far as we know, this is the first large-scale application of influence maximization for public health, done in collaboration with 3 nonprofits, My Friend's Place, Los Angeles LGBT Center, and Safe Place for Youth. We recruited 250 youth in each of the 3 arms of the study. The first arm is Sampling Healer, our algorithm. Second arm is degree centrality, the more traditional approach that gets used. And then the third arm is no intervention at all. And we recruited peer leaders, had them spread information. At the end of 1 month, we looked at change in behavior. At the end of 3 months, we looked at change in behavior. And here's what we found. With Sampling Healer in terms of HIV risk behavior of reduction in condomless anal sex, we can see that there's more than 30% reduction in HIV risk, this HIV risk behavior at the end of 1 month. But with degree centrality and control group, there is no change. At the end of 3 months, degree centrality begins to catch up, but Sampling Healer is still better. But what's important here is that the speed with which behavior change happened with the Sampling Healer is important because this is an HIV risk behavior. And this is a community where youth come and go, and therefore having this information out there faster and behavior change faster is important. We also looked at other behaviors like reduction in condomless vaginal sex. And again, there's more than, Sampling Healer seems to perform better. This is clearly appreciated by our collaborators, as you will see in this video.
Beautiful way to kind of like marry this tech world with this social service world, like, and how we can kind of go deeper and impact young people and elevate them.
If this group became a really big thing, it could really help out a lot of youth.
So having done that work, we have also taken some next steps. I'll outline some of the ongoing research directions. One is fairness in influence maximization. So our first study looked at a simpler version of influence maximization where we just did 1 step of influence. And there are many applications of this 1-step influence approach. This becomes very much like a graph covering problem because we're selecting nodes to cover the graph. But some of these nodes are absent, as we know, we saw from this peer leader no-shows. So this is a robust graph covering problem. And if we apply traditional robust graph covering techniques to maximize worst case coverage, we see that in our domains, there's actually a disparity in the way different racial groups get covered. So we've looked at different ways to remedy this situation. Max-min fairness, for example, tries to maximize minimum utility of any community. Diversity constraints takes inspiration from cooperative game theory. But each of these is a point solution that arrives at a particular trade-off in terms of disparity of coverage, reduction of disparity of coverage and overall coverage. And ultimately, this decision of what's the right trade-off is best, in our opinion, left to a policymaker. And to that end, our AAAI paper this year looked at allowing a policymaker control of this trade-off via an inequity aversion parameter. The second approach has been looking at reinforcement learning for influence maximization. We are excited that it actually seems to lead to better results than the hand-created algorithms that I showed earlier. Testing them out in the real world is something very exciting that we look forward to in the future. All right, so let me move on to the next topic, which is health program adherence. And remember the data deployment pipeline I mentioned. So I'm going to talk to you about the predictive model first, and then the prescriptive algorithm as to who to intervene on next. The domain here is something we've been working on in Google Research India in maternal and child care. The situation with respect to maternal and child care in India is terrible. Woman dies in childbirth every 15 minutes. 4 out of 10 children are too thin or short. And we are very honored to be working with this nonprofit called Arman, which works with 18 million women in India. They have this program called M-Mitra, which is a program that gives a weekly 3-minute call to new or expecting mothers. The call is something like, no, you are 6 weeks into your pregnancy. You should use this health supplement. Or your child is 3 months old. Enroll them in this government program. They've shown in randomized control trials that women who enroll in the program and stick through the program, there's 150 phone calls listening to them, lead to significantly better health outcomes for themselves and their babies compared to those who don't listen. I've listened to these calls. They're entertaining calls in the local language, in the voice of the local health worker. Now, one challenge Arman faces is that 1/3, 30 to 40% of the women who enroll will become low listeners or drop out of the program. And thus, they don't get the benefits of the program. Our task was to predict ahead of time which beneficiaries, which women were likely to drop out, so that Arman could focus its interventions on them and stop them from dropping out. So consider here this woman number 1. This is the kind of data we get. Woman number 1 doesn't pick up the call when the first call is made, but picks up the phone for this automated voice message in week 2, 3, 4, and 5. Woman number 2 picks up the call in week 1, week 2, but not in week 3, yes in week 4, but not in week 5, and so on and so on. And we have hundreds and thousands of these phone call patterns. Now, it turns out that in this example, woman number 2 and 4 eventually dropped out of the program. If we could predict in advance to Arman that woman number 2 and 4 are at high risk of drop off just from looking at 1 month of their listening pattern, then Arman could live call them, go to their home, and tell them that they shouldn't drop out of the program. And so we built such a classifier. Then we did a pilot test with 18,000 beneficiaries, taking their data from November and December of 2019 to make predictions, and then tested them against actual drop-off in the spring of 2020. And what we find is that our predictions are pretty accurate in terms of recall precision F1 above 0.8. Okay, so we made good predictions, but if we intervened on these women, would they actually stop dropping out of the program? So we looked at 8,000 beneficiaries, and there were 4 groups that were created. I'm here showing you results from 2 of the groups. The other groups included texting and calling and so forth. Here, control group, nobody was called. Call intervention group, these women who are predicted at high risk were given a live call, a half-an-hour discussion. They stay in the program. What we find is that the call intervention actually helped these women being retained in the program at a much higher rate, twice the rate, than not intervening on these women at all. So this is hopeful in terms of allowing these women to be retained in the program. And in fact, this prediction software has been made available to Arman. They're making predictions, and they are live calling these women, retaining these women in the program. So it's very nice to see all of this happen. One challenge we face, though, is that we will identify a very large population, 20,000, 30,000, even many more women, as being at high risk of drop-off. And so how do you select the ones to actually intervene on? I'll come to that next. But before we go there, I wanted to show you other domains where such predictions of lack of adherence can be useful. One such domain is tuberculosis, which is the cause of 500,000 deaths per year in India, with 3 million people who get infected every year. So one treatment for TB, this treatment for TB is to take these pills for 6 months. It's a very difficult treatment. So people will stop taking their pills after some time, which is dangerous for them and dangerous for society because of drug-resistant bacteria. So there are digital tracking technologies to try to get these people to call a number, and using those phone calls, again, try to track if people are taking their medicines or not. So again, with a nonprofit called Everwell, we are looking at the call patterns to predict where these patients are at risk of drop-off so they can be intervened on, stop them from dropping out before they drop out. And these are results from 15,000 patients and 1.5 million phone calls. And we can see that we improve accuracy of prediction over their rule-based system. And this is work where we've made progress in terms of prediction, deploying, whereas with the Arman system, it's being deployed. This particular system, we are in the process of negotiating its deployment. So far I've talked to you about prediction, but still it leaves a very large volume of people predicted to be at high risk. Who do you actually intervene on? So supposing we have 1,000 patients under the care of one health worker, and they can only call 20 patients a day, something like that. Which patient should they call per day? So you could imagine this health worker saying, I'm going to call the first three, if three is the budget, these are the 3 patients I'm going to call. She calls them, and this is in the TB domain, and the first 2 say, hey, I took my medicine last night. The third one says, I didn't take my medicine last night. Then she will note that, encourage them to take continue to take their medicines. And then next day, she has to decide which 3 patients do I call today. And so she may select the next 3. And so on and on it goes for 180 days, because that's the treatment length for TB patients. So you can see that this is a difficult problem for a health worker to choose K out of these N patients every day. And one approach we've seen in Mumbai is a round robin approach. So they'll call the first N, and the next N, and the next N, and so forth, which is wasteful because now you're calling some patients again and again, even though they are taking their medicines regularly. And you're not calling some patients who need more encouragement because their turn hasn't come yet. So how do we solve this problem? So we cast this problem as a restless bandit. So you can imagine each arm is a patient, is modeled as a PALM-DP with 2 states. Either they're adhering to taking their medicine or they're not adhering. And there are 2 actions. Either you can call them or not call them. And now we want a policy for choosing K patients to call per day. In this case, we're going to assume that the transition probabilities are known from past behavior data, and I'll come to relaxing that assumption later. So now we have 2 actions per PALM-DP. So this is when the arm is not played, when the patient is not called. We have no observation about the patient. We may have some belief, the probability of their adhering to taking their medicine. And when we don't call them with no observation, we have a change of that probability, an update of that belief, generally that the probability of adherence has gone down. When the arm is played, when we call them, they tell us, I've taken my medicine last night. Uncertainty collapses. So we get this particular structure of a restless bandit. We've called it a collapsing bandit in our neuroscience paper. Because with that observation that they've taken their medicine, we can now reduce that uncertainty. And next day we have a different belief. Or the patient may say, I didn't take my medicine. Again, we now have some information about them, and we get to a different belief state. This collapsing nature is important because this fixes the total number of belief states that we can get to. And because of that, we can construct a fast algorithm for these restless bandits. For those of you who are familiar with restless bandits, you know these problems get solved by computing a Whittle index. And we show that these collapsing bandits are indexable, so we can compute Whittle indices that lead to optimal results under some conditions. And so in our work, we show that our algorithm, which exploits the special structure of collapsing bandits, leads to a much faster running time compared to the best baseline, and a solution quality that is very close to the optimal solution quality. I wanted to talk about 2 directions that we are pursuing. So in terms of algorithmic improvements, previous work has often focused on 2 actions per bandit. So essentially either call or not call would be the 2 actions. Instead, now we have extended it when there are multiple actions. You could imagine a patient being called, sent an SMS. You could go to their home. So there are multiple action types. There may be risk averseness on our part. So risk-aware restless bandits. And I mentioned earlier that we assume, we start with an assumption we know the transition probabilities, but we are also looking at learning these index values, the Whittle index values via Q-learning. We are also excited about an ongoing trial with 10,000 subjects with Arman with these restless bandit interventions. And so this is something where restless bandits are being applied on this large scale. And we will know in a few months how these results look. So we're very excited for that. I'll now turn to the third topic I wanted to cover briefly and then stop for questions. So this is work with COVID-19. In the spring of last year, after everything got shut down, we started collaborating with our Harvard Chan School of Public Health, building up this agent-based simulations to model COVID-19 spread dynamics. And so this first work was published in the Proceedings of National Academy of Sciences. And then AAAI, we reported tracking disease outbreaks from sparse data, where testing data is from a population, say at a university, you test some batch of students, but the data is noisy, and trying to detect if R has gone over 1, if there is an outbreak. But I wanted to just briefly cover this work with COVID testing policy, which is perhaps been the more influential of the work we've done with COVID testing. And this is work done with Professor Michael Mina, who's been spearheading this effort for rapid COVID testing in the United States. So there are a range of tests that have entered the market with varying sensitivity and cost. The PCR test detects low viral concentrations of 10 to the power 3, but has a higher cost. And it takes a day or so to get results back. And there are these antigen strips that Michael has been advocating tirelessly over the past year to be made available to everybody. It requires a higher viral concentration, but has a lower cost, and we get results back quickly. And so the question Michael asked us was, could we do simulations, agent-based simulations, to see which performs better? So you could imagine a campus like Harvard or Alberta or what have you, where you're testing the whole student population, and anybody who tests positive, you isolate them. And the question is, which test is better, PCR or antigen strip? So if we were able to do both tests at equal frequency, let's say every 3 days, and isolate people, and we get results back quickly, and we isolate people quickly, then indeed, on the y-axis, I'm showing you total number of infections. Indeed, the less sensitive antigen strip is worse. The PCR test is better. But as we discussed, the PCR test takes longer to come back with its results, a day delay. If there's a day's delay in getting the results back, there's a day's delay in isolating the positives, which means that suddenly the advantage of having this PCR test is lost. There's higher numbers of infections. Similarly, if because of cost, we can only do these tests every 5 days instead of every 3 days, and we can do these antigen strip tests more rapidly. Again, the advantage of this more sensitive test is lost. In short, rapid turnaround time and frequency is more critical than sensitivity for COVID-19 surveillance. This antigen strip, even though less sensitive, is better for COVID-19 surveillance. This work has been covered extensively in the news media, New York Times and Washington Post and others. We were beyond thrilled to see Dr. Anthony Fauci discussing this particular paper. And Michael, of course, has been just tirelessly advocating for these antigen strip tests. And he's consulting with the Biden task force on COVID. And so today, as you know, very recently, these tests have become available over the counter. And we are thrilled for the work that we were able to contribute to allow Michael to have this kind of advocacy with FDA and CDC. So at this point, I'm going to switch over to conservation. I'm going to talk about that for 10 minutes. But before I do that, I'll take a short break and wait for any questions people may have.
Milind, I have a quick question. It's from Andy Gable, and it's about the health thing. We too, in our jurisdiction, is we have a small health jurisdiction of 4.5 million. So it's like some of the big providers in the US, but remember our healthcare system is slightly different. One of the challenges we face is not just making the case of the trade-off you showed us between sort of the accuracy versus timeliness. So me and some of my clinician friends have been advocating for what we call short cycle learning to identify at-risk communities. And you would understand immediately just by the title, right? It's how quickly can we get the test results, integrate them into our consolidation of clusters of profiling of communities, to see which communities change at risk and should be the subject of public health interventions like you spoke of earlier. The challenge we have is getting access to that data. So, well, you've got some attention in the United States, including Fauci's reference to the article. What are the challenges of actually getting the data? So now that you can do the tests over the counter without health system intervention, can you create a mandate for people to share that data? If you could, that would be marvelous, right?
Right. No, I understand. And I guess what modeling was done was to show, I mean, I totally get it. I guess from our work, what we said is, let's suppose people do this test, in their own home. So the idea is that privately people can do these tests. And let's suppose that not everybody actually acts on the test. So somebody may test positive, but still go to work.
Yeah.
What we find is that even if, that is a high fraction, let's say 20% of these people, 30%, whatever, some fairly large fraction actually still go to work, even though they know that they've tested positive. It's still beneficial to, in terms of total number of infections. So in other words, I agree with you that there are challenges in getting data, and the challenges, I guess one of the points we were trying to make here was that, or rather Michael has been making, is that this is a test where people can preserve, have their privacy. But what we're saying is, even if people aren't completely compliant with the results, we would still get some benefit out of it. But you're right that if we could get access to this, it would be even better from a public health perspective.
I like the modeling that you were talking about earlier on. With that modeling helps you understand the variance, if you like, in reporting accurately or not, right? And that too is highly valuable. Yeah, so thanks for that.
Thank you. So let me go on with the work in conservation. I'll talk for about 10 more minutes, and then we'll be happy to take questions. So, protecting wildlife across the globe is an important challenge. It's important to preserve biodiversity. Something like the Queen Elizabeth National Park in Uganda, there's magnificent wildlife, but there's threats to this wildlife. Traps or snares, thousands of them that get used to maim and kill wildlife. And you can imagine rangers, a very small number of rangers, patrolling these parks, and you can see how difficult it is to try to figure out where these snares are. So can we help them? And to that end, we model this problem as a Stackelberg security game. So we divide up the park into 1 kilometer by 1 kilometer grid squares. And each grid square is then a target, and we're going to give them a patrolling strategy using this game theoretic approach. Stackelberg security games is something we've been working with for the past 15 years or so. But for the benefit of those who may not be familiar, I'm going to give you like a 1-minute introduction. So imagine now there's a 2x2 game here. We have a ranger, and the ranger could always patrol area 1. If the ranger always patrols area 1, a poacher will put snares, traps in area 2. The poacher gets a positive reward of 1. The ranger gets a negative reward, -1. If as a result, the ranger says, I'm always going to patrol area 2, the poacher will now place snares in area 1. the poacher gets a positive reward of 5, the ranger gets a negative reward -5. The point here is that the ranger's patrols are seen by the poachers before, and the poachers act second. If the ranger were to adopt a randomized strategy, a mixed strategy, 60% of the time being in area 1, 40% of the time being in area 2, it's more difficult for the poacher to predict where the ranger will go, and that leads to improved expected utility for the ranger. Past work focused in counterterrorism has focused on adversaries who are extremely strategic. Here we are working with boundedly rational poachers. And so we're going to use their past activities where they have placed their traps in order to learn their response model. If you patrol a certain target with a certain frequency, how will the poachers react? So we have past data from which we are going to learn this model. So we have 14 years of data from Uganda, range of patrol frequency for each grid square. We have information about distance to river, roads, and villages, and so forth. And so we can try to learn the probability of where snares may be placed, probability of finding a snare per 1 kilometer grid square. I'm going to, in the interest of time, skip over the ensemble of classifiers that we built in order to make these predictions and go to the pilot test that we did in Uganda in fall of 2016. We identified 2 9 square kilometer areas that are shown with these green dots. You can see that they don't overlap with the red dots, which is where previously snares have been found. We are essentially asking rangers to go to these infrequently patrolled areas. They're not patrolling these areas. We're telling them you're going to find snares there, even though you're not patrolling them. And so in this pilot test, which is conducted over a month, we identified these areas. The rangers started patrolling them, and they found lots of things. Among them, a poached elephant with its tusks cut off. We were too late for this elephant, but they found an elephant snare roll afterwards. So poachers were active in the area. They were killing these elephants, but before they could kill the next set of elephants, we were able to remove this elephant snare roll, potentially saving lives of elephants. And then antelope snare rolls were found and removed. This pilot test was very encouraging. And now it was time to do this more extensive test in 3 national parks: Queen Elizabeth, Murchison Falls, and Shreveport Wildlife Sanctuary. We identified 24 areas in each of these parks. Some we designated, we predicted were high risk, more snares would be found. Some we predicted to be low risk, less snares would be found. These are all infrequently patrolled areas. And then we asked rangers to go patrol them for 6 months each and report back results. And here's what we found. Where we predicted high risk, more snares were found than where we predicted low risk. And in fact, for low, medium, and high, similarly, we found that our predictions matched the number of snares captured in each of these areas. In Cambodia, in the Shreveport Wildlife Sanctuary, our system paused. From 2018, they had 100 snares captured per month. Once Sparse got deployed, the number of snares captures were 500, more than 5-fold jump in the number of snares captured. They're now at a point where they're continuously using pause. In 2021, just this last month, they found 1,000 snares and removed them. And here's some pictures of these snares being captured. So today we are very excited that pause has gone global. It is now integrated with the SMART platform. For those who may not know, SMART is the system that is active in 800 national parks around the globe. It's a collaboration of World Wildlife Fund, Wildlife Conservation Societies, and 13 other conservation agencies. So this is the software rangers use in order to note down where they found poaching and so forth. So pause is now made available to rangers around the globe to start using to make predictions of where poaching is going to happen so that they can remove traps and prevent poaching. And we are beyond Cambodia and so forth that I mentioned. There are now all these other parts that are beginning to use the software, they're testing it. So it's a very exciting time in terms of seeing us being useful to the rangers in the hard work that they do in reducing poaching around the globe. So this, of course, has led to many interesting new research challenges, which I wanted to mention as well. So first direction, I'm going to mention 3 directions, and each in 1 or 2 minutes, so this talk will wrap up in about 5 minutes. The first one is integrating real-time information. So far I've talked to you about data being collected from the past months or years and using that to predict future poaching. With drones, like done with this nonprofit called Air Shepherd, they fly these drones like in Kruger National Park in South Africa, and they beam these infrared videos late at night to a van where a human can look at infrared videos to spot human figures, poachers, to try to stop them. Of course, this is a very difficult task for a human being. So our automatic poacher finder system called Spot automatically detects these poachers and wildlife so that they can alert rangers. So this is how Spot is supposed to work. The drone will fly overhead, Spot will run and automatically detect poachers. And then it's a human being who's going to call a ranger to say, hey, come stop these poachers. However, we have very few rangers out there. So the probability the ranger arrives might be 0.3. So there are many instances where we can spot a poacher, but we can't get a ranger to go there and stop them. So what do we do? So our collaborators, these Air Shepherd, for example, have a deceptive signaling technique to try to deceive poachers to indicate a ranger is arriving. It's late at night, they'll turn on their light and they'll fly towards the poachers. And they've shown that when they do that, the poachers actually run away. However, if you always turn on the lights when there are no rangers arriving and fly towards the poachers will figure this out. So we must be strategic in our deceptive signaling. And so there are these Tackleberg security game models for optimal deceptive signaling. I'll just give a brief overview of how this works. Supposing there's a 30% chance that a ranger is present in our grid square and 70% chance the ranger is not present. The drone flying overhead not only knows the mixed strategy, they know the pure strategy where the ranger is actually present or not. If the ranger is present, they'll truthfully signal to the poacher the ranger is present. When the ranger is not present, they'll sometimes signal to the poacher that a ranger is present and sometimes be honest and say, no, there is no ranger here. So from a poacher's perspective, these probabilities are adjusted so that even though they know that whenever they get a signal, 50% of the time we are lying, it is in their interest to actually believe the signal and run away. And more recently in our Amos 2021 work, we're again trying to use reinforcement learning for this deceptive policy generation. A second direction that we're pursuing is to tailor these learning predictions to our ultimate objective. So as we know, we first do these predictions to predict our adversary target values. But next, we must plan coverage, patrol coverage using game theory. If our resources are limited and we can only patrol these 3 targets, which are shown in red with the red boundary, then trying to maximize accuracy across all targets is useless. So instead, if the goal of the prediction system is to maximize defender expected utility, then that would allow us to focus attention on these on the targets that really matter to our defender expected utility. And this we've called game focused learning. And essentially it means gradients get passed back from the decision rather than just the prediction. And we've shown in simulations that is in, for example, with Murchison Falls National Park data, that it leads to better results. Testing them out in the field is again difficult. I'm going to go over very quickly through the third direction, which is there are parks where there's a lot of data and there are parks there's very little prior data. And now you have to balance exploration to collect more data and exploitation to avoid illegal activity. And our AAAI 21 paper looks at balance using this lizard multi-arm bandit algorithm to try to balance these two. So I'll end here by drawing on key lessons we have learned. First, achieving social impact and AI innovation goes hand in hand. Second, we have to look at the whole data to deployment pipeline when we talk about AI for social impact. It's not just about improving algorithms, but it is actually about achieving impact. It's important to step out of the lab and into the field. It's important to embrace interdisciplinary research with social work and conservation and other disciplines. Lack of data is the norm. You saw there's no social network that's really available. There's all sorts of challenges that we have about state of the patient, whether they took their medicine or not. So lack of data is the norm, a feature of the domain of this whole area of work, and must be part of the project strategy. And finally, our ultimate goal is to empower nonprofits to use AI tools and avoid being gatekeepers to AI technology for social impact. I wanted to thank all my collaborators, but I also wanted to end by pointing out that we are hiring at Google Research India for anybody interested. Postdoc positions, research scientist positions. I'm happy to talk to you. There'll also be postdocs at Harvard coming up in the future. And so, yeah, if anybody's interested, please contact me. Thank you. Thank you for listening to me. And I'm now happy to take any questions people may have.
Wow, what an amazing talk. There's so much good stuff you described. Lots of papers to look at.
Thank you.
Question about the pause work you mentioned towards the end. Obviously, as you talked about for the final part, the poachers are also trying to respond also. When you publish the pause results, that gives them information. Do you have to go one level deeper? You published one level deep, but you actually go 2 levels deep to catch them? Or I assume you never published the wrong algorithm just to deceive them, but.
So we don't publish them. So they wouldn't allow us, I shouldn't say they wouldn't allow us, but
I don't recommend it right now.
Right. I mean, they usually want to see the publication before it goes out, and we never publish the raw maps.
Of course.
So they to show the poach. So you're absolutely right. That would be a problem if poachers get to see what we are predicting. I have asked our collaborators if the poachers would be sophisticated enough from our algorithms to figure out what is going on and then counteract them by taking deceptive actions by, for example, putting traps in different locations so that the algorithm gets fooled and makes wrong predictions. And their thought is that we're not there yet, at least yet, but it's a multi-billion-dollar industry.
So they could be, yeah.
And they are going to catch up at some point.
They're going to use GANs to outwit you.
Yes. And so this is something we have to be prepared for in the future, although we are not there yet. But we've seen situations, for example, in Cambodia, after pause was deployed, poachers got frustrated and rangers got into a gunfight with poachers. Just before our trip there in 2019, one of the rangers was shot.
Oh my.
I went to, fortunately didn't die, they were saved, but these things are happening. The poachers are reacting, and if you're thinking about more robust machine learning that is able to handle poachers counteracting, that might be something we'll have to think about in the future.
Okay, well, for multi-billion industries, they've got clever people. Unfortunately, they have clever people also. Great talk. Wow, that was amazing.
Thank you.
Thank you.
So one of the questions is just about the philosophical perspective, Milind, is that it's like when I try to encourage graduate students to work on clinical support decision systems from clinical data, it's relatively easy to distinguish those who will invest their energy and enthusiasm because of the clinical passion and the impact. But it takes extra effort to encourage them to create their own sort of scientific credibility on the things that they do. So far, you've managed to do this, right? So a student who wants to work with you with respect to the Google challenges from India or your Harvard Center has behind it some scientific academic credibility that will help balance that. Will that last, or will you, how do you prevent yourself from becoming Greenpeace and having incredibly passionate people, but maybe not sustain the scientific credibility and attachment to, as you have with this work?
That's very kind of you, first of all. And it's I struggle with the one part of that question, or at least one aspect of that question, which is allowing our students to publish even if the work is not necessarily advancing AI in the traditional sense of improving some kind of algorithm.
Right.
Because in this work, testing things in the field, for example, requires a lot of cleverness. I mean, Matt was working, as a postdoc. I was very fortunate when he was there. And here, we were thinking hard about how to measure the impact of deterrence work. When you're trying to deter an adversary, like counterterrorism, you're deterring an adversary. How do you measure an impact of a deterrent tool? And these are hard questions, but normally if you try to publish this in an AI conference, the feedback will be that you have not improved an algorithm. And all you have, but these are things where AI conferences have to now understand
Yes.
that they have to accept these kinds of papers. And I'm very happy that AAAI has this AI for social impact track where these kinds of papers can now get accepted. And I hope other conferences will also do that. And that will make it easier, because otherwise I so totally agree with you that I have, there are students who are passionate about AI for social impact, but they worry about their careers, and they'll try to, and it's such a, it breaks my heart to see the student who really wants to do this important work, but they're spending their time trying to get their paper through NeurIPS or AAAI by proving theorems that they have no interest at all. But they are forced to do it because, just the way computer science is structured, and thinking that what matters to computer scientists is pure methodological work. And this is just terrible for us. And so I think this is something that we have to break. I sort of feel like we have to call for, it's really like a tyranny of traditional computer science that just has to go away, so that we can do this work and get accepted for it.
Well, don't give up the fight. I'm on that side of it too. You may know Kevin Leighton Brown at UBC, right? And he always surprises me for the intensity of his passion in connecting theoretical work to social impact. I think we can't give up, right? We have to break the ceiling and make sure that that happens.
Thank you for those words. Thank you. We are past 3 o'clock, so if it's time to go, it's great.
If you have any questions, please unmute yourself and feel free to ask directly to Professor Tambe.
I could ask one quick question.
Sure.
There's a lot of people who are really interested in AI for good. As a graduate student or a postdoc or a brand new faculty member, it's really, I would imagine it's quite hard to get started because you need all these connections. Would you advise someone in that situation to try to connect to a larger organization like one of the ones you're associated with, or would you encourage them to try to make those connections and start their own thing?
So I wanted to advertise this program at Google Research India for new faculty members and maybe for students as well. You can apply to our program, and we will match you to a nonprofit from the quote unquote developing part of the world. And we'll fund you and fund a nonprofit to do the work. So we have we had this call in November. We were delighted. 200 faculty members from around the world applied, many from North America. Nonprofits from around the world applied. And we are going through this matching process right now. Every professor got to meet with 3 nonprofits. Every nonprofit got to meet with 3 professors. And the ones who matched, we are going to fund them so that they can do this work. And it's in Africa. The nonprofits are from Africa, India, Southeast Asia, and other places. And please, if you're interested, watch out for the next call of this program. We would be delighted for you to participate, and hope that this would allow us to push forward using all the AI knowledge that you have, all the expertise you have, in case you're interested in applying that towards the nonprofit work that's going on in these different areas. We would be hopefully able to help you do that connection.
Yeah, I feel embarrassed. I completely missed that call. That sounds amazing. I can't wait to see what comes out of that. That sounds just like such a great idea.
No, thank you, Matt. And hopefully we can get you to apply to the next one. Great.
All right, so we are almost 5 minutes over 1 o'clock. Thank you, Professor Tambe, for a wonderful talk. It was great work, and I think everyone enjoyed your talk. So we have one-on-one personal meetings. I think everyone received that link in the email. Professor Tambe will be happy to meet someone if you fill that document. So the links are also there. And once again, thank you, Professor Tambe, for your time.
And thank you for inviting me. Thank you for all your comments, and looking forward to those discussions. So the link should be in my mailbox, Neeraj?
Sure. Let me post that here. Okay. No.
Thank you all.
I'll email that to everyone.
Okay.
Thank you.
Thank you. So I'll log out of this.